Welcome, everybody. This is Chris Watley, the Washington Director for the Council of State Governments. We've got a great webinar today. We're actually going to hold for just a minute here because we've got some participants who are joining, and also the kind of guest of honor for our webinar today, Joel Ario, who's the Director of the Office of Health Insurance Exchanges for the Center for Consumer Information and Insurance Oversight at HHS, is in another meeting but going to be joining us. We also have a whole panel of his experts, including Jen Stolbach and Barb Menard, who are on the line. But we're going to hold for just 1 minute here while we have a couple more people join on, and then we'll launch into our discussion. Thank you to everyone on the line. Wonderful, wonderful. Well, we'll go ahead and get started then. Once again, this is Chris Watley with the Council of State Governments, and I want to thank everyone who's made time to get on the call. We've got a whole diversity of people. We've got folks from actual insurance agencies at the state level who deal with these issues of setting up exchanges on a granular level. We've got some legislators who are dealing with this at the 30,000-foot politician level, and a range of other kind of levels of expertise on the line. And we're just delighted to have Joel with us. Joel left his great job as Pennsylvania Insurance Commissioner to take on this vast challenge of helping set up these state insurance exchanges, working with the states, an audience that he knows like the back of his hand. And really, no one could be better for fulfilling this role of providing some insights into this challenge, for answering your questions than Joel, and also for this Western audience, which we have on the line here, because although it sounds from his bio like he's solidly Northeastern, he's got plenty of experience from the West, having been the chief insurance regulator for Oregon prior to coming to Pennsylvania. So, Joel, we're just delighted you took time to be with us. You know, in terms of the scene or the background for the discussion that we're having today, everyone who's on this line is in the midst of what is continuing to be the worst fiscal crisis that states have experienced since the Great Depression. And Joel, you know that, having come just from Pennsylvania, but you've got legislatures who are at the beginning of their sessions, who have this challenge of setting up state exchanges and a deadline looming 3 years out. But they know that between now and June 30th, they're going to be making just huge, dramatic cuts to things that truly have huge implications, K through 12, education, all kinds of different things that have enormous immediate effects. And the decisions that they have to make on setting up state exchanges are competing against that fierce urgency of now, in terms of those budget decisions that they're wrestling with. And at the same time, they have this kind of national conversation going on in the background about the status of the Affordable Care Act. We all know it's existing law, but you do have the legal challenges that are still out there. You still have the debates that are going on across the street from us here in the U.S. Capitol. All of that affects the kind of political bandwidth that you have in every state house in America to be able to take on this challenge. And those are the kind of background factors that we all face at the state level as we go into this challenge. But with that said, we're delighted to have you on the line, Joel, to kind of lay out what the role of your office is in working with states, what the challenges are that you see for states in kind of scaling up these exchanges, and the importance of them to providing health care to Americans across the country. So with that said, I would love to turn it over to you, Joel, and thank you again, and thanks to everyone on the line.
Well, thank you very much for that kind introduction. I was a Westerner for many years, 20 years actually, out there in Oregon, and grew to love what Wallace Stegner calls the wide and vast spaces of the West. So it's good to talk to a Western audience today. Just give you a couple high-level responses to that introduction, and then I'll come back and give you a little more context. A couple high-level things related to the budget first. The law is very clear to say that the federal government is responsible for funding all, quote, necessary expenses to standing up a state-based exchange. So a state does not have any fiscal issues with working with the federal government on this. The federal government is responsible for all necessary expenses. Now, that does have a string on it, like all money should have strings on it, and the string here is that it's necessary money to meet the Secretary, make progress toward the Secretary's benchmarks. So if you look at the funding announcements we've made, and I'll come back to this in a minute, they do lay out a series of benchmarks, and the budgetary proposals have to be written against accomplishing those benchmarks. But to the extent that the proposal accomplishes the benchmarks, the law is crystal clear. Federal government bears all the necessary, pays for all necessary expenses. And think about it this way, if a state doesn't do the exchange, the federal government will then bear all the expenses of doing it itself. So the law makes sense in this way, that the cost of starting this up is on the federal government. The exchanges do have to be self-funded by 2015. So that's even 1 year into operation. It's not only the startup here till the exchanges launch on January 1st, 2014. It's also for that whole first year of operation that the federal government's on the hook for paying for the exchange. Then there has to be a self-funding mechanism, and most states are looking at assessments, although you can also look more broadly at broader forms of funding, not just putting it all on the exchange per se. So the money issue, I totally understand the fiscal crises. I did have that intimate knowledge of that in Pennsylvania. It's having some very draconian impacts on certain parts of the budget, but it shouldn't have an impact directly on the exchanges because of this federal funding. The second thing is you don't have to do a lot, particularly on the legislative side this year. I know I spoke to several CSG audiences when I was out in Oregon, and you know, always a concern was, you know, what are the real priorities for us legislatively? You know, what should we do legislatively to get this issue moving? And on this one, essentially all you need to do this year is take something like the NEIC model, or now there's a new paper out from NASHB that sort of gives the basic requirements of the law. There's a third one from a group called NASI, National Association of Social Insurance. These are, but the NEIC has the most simple core model here, and if you take that model, which basically takes the requirements of the federal law and translates it into model law legislation like the NEIC has done for literally decades, literally centuries now, of developing model laws. You take that model law and adapt it to your state, not a very tough thing to do. Your staff will know how to do it very quickly. And then the one thing you do have to answer this first year to get an exchange moving in your state is what's the governance structure. And there are options there. You can have it be a state agency. That makes it pretty simple and straightforward. You don't have to worry about who the governing board is or accountability and so forth. You're just riding on the general rules of the state government. Most states have so far, when I've talked to, have said that's a little too rigid. There are some of the rules, particularly around contracting, maybe around compensation, that are a little tighter than makes sense for something more entrepreneurial like an exchange. So people look at the other option, at the other end of the continuum, which is a nonprofit. You can do that outside the government entirely. That's a more straight, direct thing to do too. But that does raise questions about accountability, and you do have to pick a board there and figure out all the accountability. So then that tended to make states come back in the middle and create something called like a quasi-governmental entity, and most states have these, like a teaching hospital may be such a thing in a number of states. And there you do have to think of a governance structure, you know, typically like a governor and a legislator appointed board, some combination of those two. And then you think about conflict of interest rules and so forth. So there's some governance issues, and there's a lot of guidance out there about that. But once you've done those things, and then people get into the next level of questions about, you know, you're going to have the market go to 50 lives or 100 lives in the small business side. Are you going to have rules about adverse selection in and out that are the same or not, and, you know, et cetera, et cetera. Those are all questions that, frankly, probably would be better left to this new governing board to look into on behalf of the legislature and come back next year with specific answers to those. So you don't have to do a lot of the deep work this year. You just have to kind of get the process started, and then there's some IT things that the board would want to be in charge of moving forward. But those are the core. So basically it amounts to there's no funding issue because the federal government will fund everything that's necessary, and what has to be done in terms of a legislative lift can also be fairly straightforward, and the tough issues can be deferred till next year when you can get a better report from the board. So that's a quick context kind of in response to the introduction there. Let me say a couple other things, and then I've got Barb. Are you on the phone too?
Yes, I am.
Okay, so I'm going to give you kind of a pretty high-level review because that's the level that I have, good knowledge of, and then Barb has a much more detailed knowledge, and so I'm going to turn it over to her after I do maybe 10-minute kind of broad overview here, and then she can follow up on questions with you too. So the basic lay of the land that I think is important for people to know is that where our process started was in August. We put out planning grants, an option for people to apply for planning grants to all 50 states. And in September, we're gratified that 48 of the 50 states took up the application and sought the $1 million planning grants that we were offering. So since September, 48 of the 50 states plus the District of Columbia have been in one form or another working on planning a state-based exchange. So we've had engagement now for several months from all the states. You might not know that from reading some of the comments that are made in the paper, but I find that every time I read a comment in the paper from a particular state, they're likely to get a phone call from somebody else in that state later that day saying, we obviously have our concerns and blah, 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 but, we're still working away in our state on the details here just at least to cover our options depending on what happens in the future. So that's kind of the status of things. The 49th state, by the way, is now on board too. That's Minnesota. Changed governors, and they've applied now for their planning grant, and we're about ready to finish with that review, and I'd hope that they'd get their grant and be able to move forward as well. The only state that's not currently then engaged is Alaska, and they illustrate some of the complexities here. A very large, geographically large state with a pretty small population, more remote than any other state except Hawaii. It's just a more difficult state to do this in. We're committed to working with Alaska, whether it ends up being an Alaska exchange, a regional exchange with somebody else up there in the Northwest, or a federally operated exchange up there. We'll make that work. But for now, we have full engagement of the other, maybe not full engagement, we have engagement by all 49 other states. So the next step in this process, which we announced on January 20th, is what we call establishment grants. And that's moving now from the planning process to the implementation of the exchange. And if people who really want to understand the details, I'd say the single best document to read is on our webpage, that funding announcement, because it goes into detail on exactly what the different areas, there are 11 different areas called out in that announcement for development of an exchange. And it goes into detail on each one. It has benchmarks on each one. It talks about making progress towards having your exchange up and ready by the time the Secretary has to certify exchanges on January 1st, 2013. And there are basically two broad approaches. One is for states that are ready to go the whole 9 yards, there is an option of multi-year funding through 2014 that you can apply for even this year, and then although there'll be annual reviews under that, you basically have your multi-year funding started this year. There's a tall burden to get into that category. You have to have the authority, so that's either a law or some kind of executive authority that you have to it clarifies you can implement all of the different aspects of the law related to exchanges. You have to have your governance structure in place. You have to have a budget that shows you got it planned out all the way to 2015, and then you have a plan for self-funding after that, and then you finally have to have a good consumer assistance program. A lot of the exchange, all of the exchange really is about the consumer and serving the consumer better in the healthcare marketplace than they're served today in most, if not all, states. So that includes, consumer assistance with people who can't follow it on the web page and have questions. It includes people who have, consumer complaints and following up that, and ultimately can appeal decisions that they think are unfair to them. All of those consumer rights are critical to an effective exchange. So that's a pretty tall burden of responsibilities for most states to meet right now. So most states probably start in the second category, which is to take one or more all the way to 11 of those areas and propose specific progress to be made in however many areas you want to take on this year. So for some states, that might be as small as, the first applications are due at the end of March. Somebody may say, well, the first 3 months, we're simply going to do a very full stakeholder outreach process, some public meetings, an advisory panel, et cetera. relatively small budget would attach to that. Other people may be taking on some pretty big chunks of IT right from the start. That might be in the millions of dollars already as a starting point, even though it's in this level 2 kind of funding here. And it's as flexible as it can be from there forward. The first applications are due in March. There's an application process each quarter. States can apply more than once during the year, so they start with some stuff now. They could have some more stuff ready later in the year, and that process continues throughout this year. As we moved into 2013, that's when states have to start moving to multi-year funding and show that they're going to be ready to stand up their exchange, because by January 1st, 2013, the Secretary is obligated to rule on whether a state is green-lighted to have its own exchange, or whether either it chooses not to, or it simply doesn't meet the benchmarks to have its own exchange, in which case there'd be this federal fallback. And the final thing I'll say before I turn it over to Barb is I do come out of the state side of this. Who was the gentleman that introduced me? I never did catch your name.
I'm Chris Wadley.
Hey, Chris. Well, thank you for that introduction. And you're right. I'm very much out of the state side of this, and I think that the fact that I'm hired into this job is some illustration of what the expectations here are in terms of trying to work with the states to set up state-based exchanges. So my hope is still that we have no federally operated exchange states, that all 50 states set up their own exchanges, because I think it's clearly the preferable route. States know their own markets. We go out and talk to the states all the time, and invariably the staff that come with me, if they haven't been out in the states a lot, say, gee, these things really do differ state to state, and there are some people here who really know their state market, and it would be very hard for us to write one set of rules that would fit all these different markets. That kind of feeling, I think, anybody who knows those state markets has. Having said that, I also know from my NEIC days, we could never get all 50 states to do the same thing on any issue. So I don't think we'll probably get all 50 to do it. We will be prepared to put a federal exchange, federally operated exchange in some states, at least initially. And so we're gearing up to do that. But again, hopefully that's somewhat of a message to everybody that, gee, if I have to choose between taking ownership over this thing, the federal government's paying for it now, I don't have to take a big step this year, I might as well at least get started and keep my options open. My sense is that in almost every state, if people really had time to focus, and I know there's tons of priorities for everybody, they would decide that it's better to at least be taking some initial steps now to keep the option of a state-based exchange open. And I hope that's one of the reasons I do prioritize coming on these kind of calls, because I hope that if only a few more people hear that message and go back and kind of talk to their state about why it makes sense for them to do this, I think you end up with a lot of people saying, thank God you brought this to our attention, because it really is better for us to be working on this from the state side. So with that, I mean, maybe since I am going to have to run, I could maybe pause here, and if you want to take a couple questions before we turn it over to Barb, and then she can go into more detail and also take more detailed questions.
That's a great idea. Why don't we just take a couple of questions here, and then we'll let you bow out, Joel, and Barb can take it over. One of our first questions is, what is the state that is not participating within the parameters of the establishment grant process?
Well, I said it's Alaska that's the one state that hasn't taken up the planning grant from us yet, or hasn't applied for a planning grant.
Okay, and another question we have is, if a state at this point decides not to run an exchange, lets the feds run it at first, is there an option? Is there anything that would prevent them from at a later date, after having looked at this, coming in with an exchange option of their own? Is it that they just miss out on the planning and establishment funding on the front end, or is this something where if you miss the boat now, you've missed it for forever?
That's an issue that we believe we have flexibility on as we've looked at our regulatory authority. So there are competing arguments on that at this point. The argument for allowing that flexibility is, again, I think overall it's generally better if the states take ownership and so forth, so that argues for flexibility. On the other hand, it does start to be expensive for the taxpayers and the users of the exchange if it moves back and forth too much, so there has to be some kind of orderly process here. And once the federal government does have to gear up to do a federally operated exchange, it may not be the most cost-effective thing to allow that to switch back quickly. So that issue isn't decided yet, but those are kind of the competing considerations on it.
Great. Another one just emailed in is, can exchange funding from HHS be used for public education and outreach on the enrollment process?
Yes, I believe so. Barb, is that correct?
Yes, it can. Yeah, there's a separate stream of funding for the Navigator program, but public education, you can use your establishment grant funding for it.
Great, great. And maybe one more for you here, Joel, that just came onto the panel. Are there any states that have indicated a desire for a multi-state exchange? You know, is there a role for collaboration or regional exchanges, and any expressed interest in that?
Yeah, there have been 3 areas where that's been kind of kicked around. One of them is the New England states, which have a lot of similarities in how they regulate, including all claims databases, particularly in the 3 northern New England states. So that's one area where there's been that kind of conversation. The second is the South, you know, the SEC exchange, I call it, down there, where there's some philosophical similarity about kind of wanting to have more of a Utah-style exchange, and, you know, just generally more on the bare bones side of the exchange than an elaborate exchange. So there's been some talk in that region. And then finally, kind of the western spine, you know, from Montana down through Wyoming, Utah, Nevada, you know, Idaho would probably be in the states that are, you know, big open spaces, not big populations, possibly discussions. But in all those cases, I think as people get further into it, the idea of a full-fledged multi-state exchange where people really are doing full power sharing, it tends to bang up against the fact that people, you know, in the end, pretty zealously guard their ability to regulate for the consumer their own state marketplace. That's why we have the system we have, is because states are different, and legislatures in each state, you know, have a hard time saying I'll defer to some, you know, kind of compact type thing was what it is in concept, you know, that would usurp my authority to provide my consumers with the laws that I think are appropriate. So more likely, I think you'll see is discussions that are about kind of sharing on certain dimensions. So Utah, for instance, has offered to many states, you know, to kind of show what they've accomplished on the IT side and share some of their IT learning with other states. And it's possible those kinds of issues, the all claims database in the New England area, maybe states are going to share around some of those issues. So I think it's going to be more like, you know, some and some among functions than it would be a full-fledged multi-state exchange.
Great. Well, Joel, we want to thank you for your time. You're a busy guy, and Barb can answer the detailed questions, which are her brief, but we really appreciate you taking time to be with us.
Well, thank you very much. That was a very kind introduction, and you know, you guys do great work out there. I always enjoyed coming to CSG. I learned one of my best jokes actually from you guys. It was about the guy who conducted a symphony, and he hired some managed care consultant to review it. And by the time the guy was done critiquing the symphony, he had it down to like 6 notes, and, you know, only 3 players in the orchestra kind of thing to make it work. It was very funny. I used to use it all the time back in those days.
It contributed to your career development in some small way.
Yes, that's right. Yes, that's right. Thanks for your time, and I'll leave you guys with Barb now.
Well, thank you so much.
All right.
Barb, over to you.
Yeah, thanks, Joel. One of the things I wanted to add to Joel's presentation, can everyone hear me okay?
Hearing you well.
Great, okay. One of the things that I wanted to add is that in addition to the funding that we're offering to states, we're also offering really hands-on technical assistance to states. So we have a team of both project officers and technical assistance staff here at CSIO, and we have project officers that are assigned a handful of states that they're working directly with, and then we've got technical assistance staff and policy staff that are issue area experts in everything from, you know, risk adjustment to shop exchanges. So if states have specific questions or you're struggling with something as you're putting together the policy, I would encourage you to contact us, because inevitably we have someone on the staff who has done some real deep thinking on all of these issues. So from the project officers to the technical assistance team to our policy staff, we want to offer assistance. And then what we want to do too is, in addition to meeting directly with our grantees, which we do on a quarterly basis, we want to offer opportunities for states to come together and do peer-to-peer learning. So if states have ideas or particular issues that they want to hear from us on or hear from other states on, that is something that we can also be helpful with and we want to be helpful with. So we really are targeting 3 specific areas. We're targeting funding, which Joel talked a lot about, technical assistance and guidance, which I talked a little bit about, and then the regulations, which I think Joel gave a brief overview of, but I just want to reiterate that we'll see an initial notice of proposed rulemaking in the late spring on the exchanges, and then we're going to see another NPRM, probably around essential health benefits in the fall. So wanted to give people a sense of that timing as well. And there are 2 pieces of guidance that we already have out that you can find on our website. We put out an IT guidance on November 3rd with CMS, and then we did an initial guidance to states on exchanges on November 18th, and both of those documents are on our website and can be very helpful too. So Joel covered a lot of what I was going to cover, so I think with that brief introduction, in addition to what he said, I'd like to turn just to questions and see if folks have other questions.
Great, we do have some more. One of them kind of relates to that next round of questions that Joel mentioned. You know, Joel said that, look, in terms of the immediate things that need to happen in the 2011 legislative cycle, it's about taking the NAIC model, enacting that, setting up a governance structure, and that it's really going to be 2012 when you have to deal with the big things. And we've got some questions that are related to those big decisions that will have to be made, even if it's a year from now. One is, what advantages and disadvantages are there to merging the individual and small group markets?
Hang on for one quick second. That's really going to vary market to market, and I guess I'm a little wary to give a blanket answer on that, because there will be some answers in some markets where it's going to have a rating impact. I would say that the benefit would be that it's going to be administratively more simple to administer. So you're going to have one administrator who will be administering the exchange for the small group and the individual markets, and that's going to create some efficiencies of scale. That's going to create some cost savings and administrative costs. But what you want to look at is really how is that going to impact your risk pool, and how is that going to impact your rating for individuals, your costs for both individuals and small businesses, and that's something that's going to vary market to market.
I know that the RAND Corporation came out with a study recently called the Establishing State Health Insurance Exchanges, and one of their conclusions was that if you separate the two, you make it more costly for individuals and less costly for the small group market, where the reverse is true if you keep them together, that basically the small group market ends up subsidizing the individual group market, and therefore there's kind of a political choice there. It's that do you want to go with a system that makes it as economical as possible for that individual right now who has no access to employee health care, who's faces some of the most expensive health care possible, or do you want to set up a system in which your small group market, which are small businesses, startups, entrepreneurs, have the lowest health care costs? Have you engaged at all in any of those debates, which I believe that study was funded by the Department of Labor?
Well, I think you laid out exactly what the crux of the issue is. And again, what I want to say is there'll be some administrative simplification and cost savings if you do merge, but there will be an impact on premium for both the individual and the small group market depending on what the decision is. And we're really going to be deferential to states to study their market, determine what their needs are, and to make that decision. That's something that we're going to allow a lot of state flexibility on, and we'll be encouraging states to use both their planning and establishment grants to study their individual markets and to determine which way they want to go with that.
Another one, how should states approach data collection? What data should be collected in order to establish the exchanges? And who's responsible for all that data collection?
There are a lot of states out there right now that are already collecting data, and what we want to do is we can talk more about that. I mean, primary care offices, they're all payer databases. States right now with their planning grants are starting to do the background research and the data collection. We have a collection of what states are doing, and we are going to put that on a portal that states will be able to access, and that can be helpful.
That's actually another one of our questions, is what kind of best practice portal is there? Is that live yet, or what's the schedule on getting that information out there?
Ours is not live yet. We're hoping to have that live this week. Right now, NASHP has a pretty good portal out there, the National Academy of State Health policy has a good portal that is exchanging information, and we should hope to have one up later this month.
Okay, great. Another thing is basically you have the huge Medicaid expansion that's happening through the Affordable Care Act as well, and basically that expansion effort and the exchange effort have to be able to communicate and interact. And to what extent have the structures necessary for coordination between Medicaid and enrollment and exchange enrollment been established or clarified, or what kind of thought process is going on there?
That's a great question, and it's one of the things that we're encouraging states to be thinking about and doing. What we've seen as we travel the states, and I think this will be no surprise to anyone from the states on the phone, that there's been a sort of a cultural divide between departments of insurance and Medicaid departments across the country. They don't really talk to each other. They often don't talk the same language, and we're encouraging states through this process to be both working together and design a system that then both the exchange and Medicaid will be using. So there'll be no wrong door, and when people come into that system, they'll either go towards Medicaid, they'll go towards the exchange with a subsidy, or go towards the exchange without a subsidy. So we're kind of, pulling everybody together, and at the federal level, we are modeling that. We don't do anything without Medicaid. Joel is constantly working and consulting with Cindy Mann and Penny Thompson at Medicaid at CMS. We're working with them all the time. So every piece of guidance that we are putting out, every funding opportunity that we are putting out, we are doing that hand in glove with CMS to make sure that we are going down the path that will work for both the Medicaid program and the exchange, because again, there'll be no wrong door. We are encouraging states to do the same, and if you see in your establishment grant funding opportunity announcement, there's actually a requirement in there that states Department of Insurance and Medicaid departments sign a memorandum of understanding that they will be working together going forward. So we're encouraging that at the state level, and we're modeling it at the federal level. Great.
Another question we have, obviously all the changes in the insurance market affect states as employers. So there's a lot of discussion as to how all the different changes in the Affordable Care Act affect the insurance that states provide as employers to their employees. And there's a question as to how will coverage of state employees and retirees work through the exchange. In particular, on the retiree side, you have states who are changing the retiree health care benefits right now. So you actually have some people right now in states across the country who will probably no longer be receiving the same kind of retiree health benefits that they were in the past, but may not be Medicare eligible. Is there any discussion about those kind of concerns and linkages?
Well, yes, there are, and I'm going to say a couple of things about that. One, we're going to stay silent on what states do with their current employee coverage and on their retiree coverage. That's going to be totally a state decision. Some states will choose to put their employee pool into the exchange to get it going, to broaden the risk pool for ease of administration, so you don't have one pool buying insurance for your state employees and then one pool that then will be coverage for other people in the state. So some people will be putting that together. We're going to stay silent on that. One thing I will say for early retirees is that there are several things under this piece of legislation, including the early retiree program that we currently have up and running, that allows people to get insurance before they have Medicare at a much more affordable rate than they were able to before. But also, once you fast forward to when the exchanges are up and running, early retirees on their own will be able to enter into the exchange and get a quality, affordable plan under the exchange in a way that they cannot today. So a lot of what's under the ACA, both currently between now and 2014 and once the exchanges are up and running, will help early retirees. But having said that, the state employee pool, we're going to defer to states on whether they want to put that into the exchange or not, and states will be thinking about that and modeling whether it makes sense or not.
Great. Another question. States ultimately will have the option of opening these exchanges to large businesses, to beyond the 50 or 100 firm employers. Some of that same analysis that Rand did showed that, under the baseline expansion, just the normal options that states have, that ultimately, once it's fully implemented, you'll have 68 million Americans getting their insurance through the exchanges. If states were to exercise that option and allow large firms, the biggest firms in America could be eligible for putting their employees through the exchanges, that number could be as high as 139 million. So basically, at that point, the exchanges are the primary vehicle for all Americans to receive their health care. They're the single biggest element of the American healthcare system. Does the department have any thoughts yet as to where it stands as to whether to encourage states to go in that direction, as to how that would affect the operation of the exchanges? Any kind of thoughts, broadly speaking, about some of those big picture questions that states will face once they get these up and running?
Yeah, and I appreciate these questions. They're all questions that states should be thinking about, and you're going to hear a little bit of I hope I don't sound like a broken record when I say that we're going to allow states flexibility on all these issues, because this really is a state-based model, and the states are going to have to investigate and research their own individual markets to see what makes sense for them. Around this question, what states should be looking at is, if you have a firm that's large enough to self-insure, does it make sense to allow them into the exchange, given the fact that that could cause problems with adverse selection? So states are going to have to model what they think the potential impact on their exchange will be. They're going to have to model what they think the best thing is for their state, and they're going to have to make that decision. So while we're still in our early stages of rulemaking, there's not a lot of guidance that we have on that yet because we're pre-rulemaking, and we're going to be largely deferential to the states around a lot of these questions.
Great, great. Well, I think we only have one final question, and that's kind of one of those questions that is always in the air anytime you're talking about health reform implementation, and that's just what happens if the Supreme Court rules against this? Is there any contingency planning going on within HHS there, or is this full speed ahead, and the kind of debates that are going around us, around the margins here on Capitol Hill, over in our court system? How does that impact what your office is doing?
Well, I am going to stay out of a conversation of the lawsuit and defer to our lawyers on that. What I will say is that we right now are working, as we have been, to help extend quality, affordable health insurance to every American and to implement the law of the land as it currently stands. So that's what we're doing right now, and I would defer to our lawyers on any other conversation of the lawsuit.
Great, great. Well, I want to thank everyone for being on the line. I think we've gotten some very important clarifying information. First of all, that in terms of immediate cost hits, this isn't something that is going to move the ticker in terms of the state fiscal crisis right now, that between the planning grants and the establishment grants, there are hopefully no direct costs that states will have to incur in the challenge they face right now of scaling these up. That's one of our first points of clarification. Second, that in terms of the legislative challenge, this session that we're in right now, that the main focus should to look at those implementation models that NAIC and others have created, if states are interested in moving down this road, and looking at governance structures tied to those. So the real challenge for 2011 is to put those relatively manageable blocks in place, and then to be prepared, once those governance structures are in place, to wrestle with these bigger, more cosmic challenges in 2012 of, do you go for a regional exchange, do you go for an individual or a small group combined exchange? Those kind of questions are 2012 questions, but you got to have the governance building blocks in place. And with that, I'd say that we're very grateful for your entire office, for Joel, Barb, Lisa, Jen, everyone there. You guys have been fantastic in state outreach, not just to CSG, but to all of the state community, and just aggressive in getting out there on an intergovernmental basis. We're delighted that our regional counterparts could be on the line, that these are issues that play out differently in different regions, and in fact, Joel articulated that as he laid out how different regional models are being considered in the states right now. So having forums like this where we bring together regional people, you get different questions than you do in other forums. So I want to thank everyone for being on the line, and if you have further questions, email them to us, and we will make sure we get those clarified working with Lisa, and we look forward to being your resource going forward. Thank you to everyone again.
That's great, and I just wanted to add a thank you from HHS as well. Thank you to CSG for inviting us, and for everyone for being on the line. And I'm not sure if you wanted me to give contact information, or if you prefer to have questions go through you, whatever is easiest.
Go through, please share your contact information.
Great, sure. This is Barbara Menard, M-E-N-A-R-D, and my email address is Barbara, which is B-A-R-B-A-R-A, m.menard, M-E-N-A-R-D, @hhs.gov.